Cancer is a disease that affects millions of lives worldwide, and early detection is key to successful treatment. In today's video, we'll be focusing on the alarming signs of cancer in women that should never be ignored. By being aware of these warning signs, you'll empower yourself with knowledge that could potentially save lives. But before we jump into the tips, I want to emphasize the importance of listening to your body. Trust your instincts and don't dismiss any unusual changes. Remember, early detection can make a world of difference. The information provided in this video is for educational purposes only and should not be considered as a substitute for professional medical advice. Consult with your healthcare provider or a qualified professional for proper diagnosis and treatment options. Now, let's start with our first sign, unexplained weight loss. Most unintended weight loss is not cancer. It's often caused by stress or your thyroid, but it can be a sign of pancreatic cancer. Stomach and lung cancers are also possible. Your doctor may ask for a lot of tests to look for a problem, including blood tests and imaging tests, like a CT scan. If you notice a sudden and significant drop in your weight without any changes in your diet or exercise routine, it could be a cause for concern. Unintentional weight loss may be an early sign of various types of cancers, such as ovarian, pancreatic, or lung cancer. Be sure to consult with your doctor if you experience this symptom. Moving on to number 2, chronic cough or hoarseness. A persistent cough or hoarseness that doesn't seem to go away may be an early sign of lung, throat, or laryngeal cancer. If you find yourself in pain or shortness of breath during a cough, it could be serious. If you cough up blood, it is serious. Smokers should pay particular attention to coughing, as it's the most typical sign of lung cancer. If you've been coughing for more than 3 weeks or notice any unusual changes in your voice, it's essential to seek medical advice promptly for a thorough examination. 3. Unusual bleeding. Ladies, it's crucial to monitor any abnormal bleeding that occurs outside your regular menstrual cycle. Vaginal bleeding after menopause, bleeding between periods, or experiencing heavy or prolonged periods could be potential signs of uterine, cervical, or ovarian cancer. Don't hesitate to seek medical advice if you encounter any of these symptoms. Next up, tip 4, changes in breast appearance. Breast cancer is one of the most common forms of cancer in women. It's essential to regularly check for any changes in your breasts, such as lumps, dimpling, swelling, nipple discharge, or changes in the size or shape of your breasts. If you notice any of these changes, make an appointment with your healthcare provider for further evaluation. Moving on to number 5, persistent indigestion or difficulty swallowing. Constant indigestion, frequent heartburn, or difficulty swallowing can be signs of gastrointestinal cancers like stomach, esophageal, or pancreatic cancer. These symptoms shouldn't be ignored, especially if they persist for an extended period. It's important to consult a healthcare professional to rule out any underlying issues. 6. Skin changes. Pay attention to any changes in your skin, such as the appearance of new moles or changes in existing ones. Additionally, skin that becomes darker, yellowish, or develops itching or excessive scaling might be a sign of skin cancer or other types of malignancies. If you notice any concerning skin changes, make sure to get them checked by a dermatologist. Next up, tip 7, chronic pain. Persistent pain that lasts for an extended period should never be ignored. Chronic pain can be an indication of various types of cancers, including bone, ovarian, or colon cancer. If you're experiencing ongoing pain that is not associated with any known injury or condition, it's essential to consult a healthcare professional for a thorough evaluation. Moving along to number 8, changes in bowel habits. Any significant changes in your bowel movements, such as prolonged constipation, diarrhea, blood in the stool, or pencil-thin stools, should be taken seriously. These symptoms can be signs of colorectal or gastrointestinal cancers. Don't hesitate to discuss these changes with your doctor to determine the cause. 9. Changes in nails. Unexplained changes to the fingernails can be a sign of several types of cancer. A brown or black streak or dot under the nail can indicate skin cancer, while newly discovered clubbing enlargement of the ends of the fingers with nails that curve down over the tips can be a sign of lung cancer. Pale or white nails can sometimes be a sign of liver cancer. 10. Abdominal or pelvic pain. Persistent abdominal or pelvic pain, especially when accompanied by other symptoms like bloating, can be a sign of various gynecological cancers, such as ovarian or uterine cancer. It's important to get these symptoms evaluated by a healthcare professional to determine their cause. 11. Changes in urination. Pay attention to any significant changes in your urinary habits. Frequent urination, blood in the urine, pain or discomfort during urination, or sudden urges to urinate can be signs of bladder, kidney, or urinary tract cancers. If you experience these symptoms, it's important to consult your healthcare provider for a proper evaluation. Moving on to number 12, persistent back pain. While back pain is a common issue, if you have persistent back pain that doesn't improve with rest or usual treatments, it's worth investigating further. Back pain can sometimes be a symptom of cancers like breast, ovarian, or colon cancer. Make sure to discuss your symptoms with a healthcare professional. 13. Difficulty or blood in swallowing. If you experience pain or discomfort while swallowing, along with the presence of blood in your saliva or when you cough, it may indicate esophageal or throat cancer. These symptoms should not be ignored, and you should seek medical attention promptly to determine the underlying cause. Next up, number 14, chronic fatigue and weakness. Feeling constantly tired, weak, or lacking energy despite adequate rest and sleep can be an indication of various types of cancers, including leukemia, colon, or stomach cancer. If you find yourself persistently fatigued without an apparent reason, it's crucial to consult with your doctor for a thorough evaluation. Last but not least, number 15, swollen lymph nodes. Lymph nodes are an essential part of our immune system, and if you notice swollen lymph nodes that are painless and don't go away after a few weeks, it could be a sign of an underlying issue, including lymphoma or other cancers. Don't hesitate to have your doctor examine any unusual swelling in your lymph nodes. And there you have it, 15 alarming signs of cancer in women. Remember, knowledge and awareness are vital in maintaining your health. If you notice any of these symptoms, seek medical advice promptly. If you found this video helpful, please give it a thumbs up and share it with others. Take care and stay vigilant about your well-being. See you in the next video.